Hello, good afternoon. My name is Brittany. I'm going to be the nurse midwife today. To whom do I have the pleasure of assessing?
I'm Charlie.
Good to meet you, Mr. Charlie.
Nice to meet you.
All right, so for our assessment today, I'm going to inspect your arms, the front of your chest, the back of your chest, and your belly. Is that all right if I feel around while I do my assessment?
Yeah, sure.
Okay, perfect. So we're going to begin our assessment like we do with all assessments by inspection. So I'm looking at both arms here, and I'm ensuring that I see symmetry. So they look about the same size on both sides. The coloring is nice and even, and it is appropriate for his ethnic background. I don't see any scaling, lesions, excessive dryness. I don't see any like bruises. So I'm gonna inspect his hands. I do see 5 digits. Let me inspect the palms. Perfect. It does look nice and moisturized. I'm gonna assess for skin turgor. We look great there. Beautiful. So bilaterally, we're looking good so far. Now about the level of the heart, I'm gonna assess the capillary refill. So I'm pushing down and I do see blanching in 2 seconds or less. If it were greater than 5 seconds, that is abnormal. And you may need to ensure that it's a warm enough environment, because sometimes if it's too cold, that can in itself cause delayed capillary refill. But I'm also inspecting the nail bed. So all of his nails look nice and rounded. I don't see any clubbing. I don't see any brittleness of your nails or any cracking or ridges. So we do look really good there. Okay, so we're gonna proceed with the posterior aspect of your exam. So I'm gonna go ahead and swivel your chair, okay? Perfect. Again, I'm beginning this assessment by inspection. Overall, the coloring of the skin looks appropriate for the ethnic background. It does look nice and even. I don't see any splotches of color on his skin. I don't see any bruising. I don't see any masses or lesions. And it doesn't look excessively red, erythema, or I don't see any pallor or cyanosis. So those are all great signs. So I'm just assessing how he's breathing, which looks nice, normal, and relaxed. His spinal cord is in the center, and his arms are nice and relaxed on the side. It does appear that the ribs are coming down at a 45-degree angle from the spinal cord, and that is normal. He doesn't appear to be barrel-chested or in a tripod position to breathe, so those are all good. And his AP diameter does seem appropriate. So we look great there. Next, I'm gonna proceed with the palpation aspect of the exam. So I'm gonna put my fingers here about T9, and I'm gonna kind of squeeze together. I'm just looking back to ensure the camera can see. Okay, so I'm gonna squeeze my thumbs together here. So big deep breath, please. And exhale. So I want to see that my fingers come apart evenly and symmetrically and then join back together again. If there was any asymmetry with that, that would warrant further attention. But it looks great there. So we're gonna proceed on with the percussion aspect. We're gonna start at the apex of the lungs here. So I'm listening to hear resonance. If I heard any hyperresonance or dullness, that would indicate some further assessment. So that's 1. Just making sure you can see me. 2, 3, 4, 5, 6, 7, 8, 9. Okay, so while I'm down here, I'm also going to assess the costovertebral ankle tenderness, so the CVA tenderness we call it. So any pain or tenderness or discomfort whenever I did that last part?
No.
Okay, so if we did have any pain or tenderness or discomfort, that would warrant further assessment for perhaps some renal pathology or some kind of inflammatory response in the kidneys. So we didn't see that, and that is a normal finding. So next I'm going to proceed with the auscultation portion of the exam. One. So as I listen from side to side in each lung, I'm listening for nice, clear, even, effortless respirations. 2 and 2. If I heard any crackles, rhonchi, rales, any adventitious breath sounds, that would be abnormal and that would warrant further attention. So I'm going to 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8, and then 9. Big deep breath. And 9. Okay, great. So we're all done with the posterior portion of the exam. His breath sounds were nice, clear, even throughout, and no adventitious breath sounds noted. So I'm gonna go ahead and turn you, okay?
All right.
Beautiful. So again, we're gonna inspect the chest, and same thing with the skin color, no erythema, or pallor noted, or cyanosis, or any lesions or lumps or masses. So I'm gonna begin by coming down by the xiphoid process, and I'm going to palpate. So I'm going to, same thing like we did on the back, I'm gonna put my thumbs together, and then can you take a big deep breath in, out, out. So I saw my thumbs nice and even, symmetrically separate, and then as he exhaled, came back together. I didn't see one finger maybe come up and the other stay the same, so no asymmetry noted, so that is a normal finding, so we look great there. I will begin by percussing. Two, 2, 3, 3, 4, 4, 5, and 5. So as I'm percussing again, I'm listening just for resonance. If I hear any like hyperresonance or dullness, that would warrant some further attention. Sound great here. So I'm going to proceed next with the auscultation portion. Again, I'm listening. I don't hear any crackles, rales, rhonchi, no adventitious breath sounds. His breath is nice, regular, and even, and clear to auscultation. 2, 4, 4, and then 5. Okay, we sound great. So next I want to assess your abdomen. So I'm actually gonna have you lay down for me, please. And I'm gonna reposition the camera so that our audience can get a peep at what we're doing here. So maybe can you back up a bit? More. Okay, that should maybe be okay. Beautiful. Okay, so whenever we're beginning to inspect, okay, maybe scoot this way so we can be more in the camera's view. Perfect. So whenever we're beginning the abdominal assessment, we're just gonna start by inspection. So first thing I wanna do is I want to assess the contour of the abdomen. So the abdomen does appear to be nice and flat. So deviations, or I guess different findings can be like a protuberance. So like surrounding below the umbilicus, we can see a scaphoid abdomen. I don't see any of that, or just like a nice and rounded one, but his does appear to be flat. So after the contour, I want to look at the umbilicus. So I do see that it's here, it's midline, and it's appropriately located on his belly. It does look all around, although he does have tattoos, the skin underneath does look even and matches the rest of his thorax. So I don't see any erythema, I don't see any cyanosis, and I don't see any pallor, so we look great there. The umbilicus is also slightly indented in, so I don't see that it's excessively indented, kind of like you may see with an obese person, and I don't see that it's herniated out. So what I see here is normal. So we've done the contour, the umbilicus. Now I'm gonna look for pulsations. So I may see some pulsating of the aorta. Now, if I saw some bounding pulsations, that is abnormal. And that would warrant further assessment. So in someone that's extra lean and maybe doesn't have a lot of body fat, you may even see peristalsis in the belly, which I don't see on him. And you may see some of the pulsations of the aorta, as long as it's not a very strong and bounding finding, then that can be normal for an excessively lean person, but I don't see that here. And I do see his belly rise and fall nice and evenly with his breath, so that is a normal finding. So next I'm gonna look for his skin. So his skin looks nice and even, appropriately colored. I don't see any bruising, excoriations, or striations. For striations, they may be kind of like pink to silverish, and I don't see any of that on him. And then I'm also going to assess with my flashlight to see, so I'm gonna come over here, and I'm clicking on my flashlight here. And if I would see any shadowing as I shine my light, that can indicate that there's a mass or some kind of lesion that I may have missed just upon inspection. I don't see that. It's like nice and even here. Now I'm gonna come towards his feet, well, from the side also. And then by the feet, I'm gonna also shine this flashlight, looking for any shadowing that may indicate, like I said, any masses or protrusions or lesions, but we look great here. Okay, so next for to continue on the abdominal portion of the exam, we actually auscultate. So if I were to palpate, I may cause some peristalsis, and that would maybe give us some gastric sounds. So I'm going to begin in a clockwise fashion in the right lower quadrant and moving along here. Now I just want to hear some gurgling and tinkling noises, which I heard. Perfect. Beautiful. If I didn't hear very many vowel sounds, to assess a hypogastric vowel sound and to be able to chart that, I should listen for at least 5 minutes in each quadrant to make that assessment. Hypergastric vowel sounds can be noted, like let's say if the patient says he's having diarrhea, it would kind of match that clinical picture. But these vowel sounds do sound nice and normal gastric. So I'm going to next begin by percussion. So I'm going to percuss again in this clockwise fashion. And I'm listening to tympani. So when he's laying down like this, it causes all of the air to rise in his intestines. So tympani is a normal finding. But again, if I would hear any dullness or hyperresonance, we may need to further assess that. So I'm gonna now proceed with palpation. So first I'm gonna do some light palpation. I'm warming my hands here. I'm gonna start palpating again across his abdomen. And we start with light palpation, kind of just to get a feel for the abdomen. And also to get the voluntary guarding out of the way. If your patient's a little ticklish, you may get the giggles out. And then you'll kind of get a feel for any lumps, masses, or any like tender or painful areas. So if you did palpate a painful area, you would want to come back and assess that last. Did you feel any pain or discomfort upon that? Okay, so next we're going to do the deep palpation. And if you do have a morbidly obese person, you may just palpate with your dominant hand, and with the upper hand, just apply some deep pressure. But he's rather lean here, so I'm just gonna palpate a little more deeply. Again, I'm just feeling around and trying to focus to feel if there's anything that's kind of poking out at me, any masses or protrusions. Feels nice and soft and rounded in there, so it's all good. Beautiful. Okay, so I want to assess two more things. We're going to assess the liver. So if the liver is extending beyond the right costal margin by more than 2 centimeters, that's an abnormal finding. Or if he tells me that he feels excessive tenderness or discomfort upon the exam. So I'm coming here at the right costal margin, and this is called the hook technique. I'm going to just palpate here with my fingers and kind of hook the liver under my hands, and I'm just feeling the margins of the liver. Any excessive discomfort? No. Perfect. And it's right where it's supposed to be, so that is a positive thing. Next, I'm going to assess the spleen. So if you can palpate the spleen, that is an abnormal finding. It's normal to not be able to feel the spleen. So here on the left side, I'm just gonna kind of roll his, so you can just lay flat, please. No, just lay flat. So I'm gonna kind of roll this portion towards me, and I'm just kind of feeling in into like the left costal margin, and I don't palpate the spleen, which is great. If you were to palpate it, you don't want to be overly aggressive because you do not want to cause splenic rupture, but that would require immediate referral. Okay, thank you so much for allowing me to assess you today.
All right.
I do wish you the best day.
Thank you.